Today let's discuss an interesting thyroid case. This is a 29-year-old female, 4 months postpartum, referred for abnormal thyroid function test because it was worked up for her fatigue. The lab showed TSH of 0.02 which is low, FT4 of 2.4 which is high nanogram, FT3 of 4.1 picogram which is mildly elevated. Clinically she has no goiter, pulse rate is 88, no orbitopathy, no pretibial myxedema. Now somebody suggested starting around methimazole 10 mg because the patient is thyrotoxicose. Now the challenging things are, what does the T3-T4 ratio suggest here? Now if this is postpartum thyroiditis, what will happen for a thyroid function in 8 weeks if you do nothing? Do you want to do a radioiodine uptake scan for this patient who is breastfeeding? And what are the alternating imaging modalities we can use if it is not? The first thing, this is a postpartum thyroiditis. T3-T4 ratio, in thyroiditis the ratio is typically low, often below 15.1 or even below 10.1. This is because the thyroid gland primarily stores thyroid hormones T4, and when follicles rupture, it dumps T4 into the blood. While in Graves' disease, the hyperactive gland preferentially synthesizes T3, leading to a much higher ratio. So T4-T3 ratio can sufficiently differentiate a Graves from a postpartum thyroiditis. The natural history is that this is a triphasic disorder. If you do nothing, the patient will naturally transition from thyrotoxicosis to hypothyroid phase in 2 to 4 months, as her stores are all depleted in the thyrotoxic phase, and eventually return to euthyroidism. That's natural history. Now, radioactive iodine is definitely not in the picture. It's absolutely contraindicated in breastfeeding due to secretion into the breast milk. Instead, a colorful Doppler ultrasound in thyroiditis can be done. In thyroiditis, you will see an absent or low flow, whereas in Graves, it is a thyroid inferno, like the thyroid is on fire. So, they'll help differentiate between these two. Most of these cases need watchful expectancy. If there is a resting tachycardia, you can give beta blockers to counter that.